Hello and welcome everybody to another ACCP STEP podcast. My name is Oliver Grundman and I'm happy to welcome everybody. It's my pleasure to introduce Kayla Lien and Brian Cicali from the University of Florida, who are also both members of the UF ACCP student chapter, currently the only ACCP student chapter that is in existence. We hope to extend that soon, but I'm very happy to welcome you both today. Would you mind introducing yourself to our audience?
Thank you. Thank you, Oliver and ACCP, for giving me and Brian the chance. Maybe I can go ahead and start. So my name's Kayla Tieng, and I am a PhD student at the University of Florida at the Orlando campus, Lake Nona, and we are in the Center of Pharmacometrics and System Pharmacology.
Hi, yes, thank you as well. I'm Brian Cicali. I'm currently a third-year PhD student, also in the Department of Pharmaceutics at the University of Florida, as well as the Center for Pharmacometrics and Systems Pharmacology.
Okay, thank you. Well, thank you for taking the time today, and I apologize for this earlier squeaking that we had. That was my daughter who's sitting in here. So I hope that is not gonna occur again. So I understand, if I stand correctly, Kayla, you actually just defended your thesis. So we can almost put a PhD behind your name and can call you Dr. Lien. But I guess it's still a little bit early at this point, but you basically met all of your requirements. So congratulations.
Thank you.
So for you as being involved, and Kayla, you have been the former chair of the ACCP, UF ACCP chapter, and Brian, you are now the current chair of the ACCP chapter at UF. Obviously, you are dedicated to clinical pharmacology. Kind of what got you actually involved into the field of clinical pharmacology? What kind of was your drive to get into this particular field?
Yeah, so in my case, because of my background in pharmacy, and then I have a chance to start doing like research when I was volunteering at the research lab back in my university at Buffalo. I kind of have a chance to see both the quantitative side and also the pharmacy side dealing with the patient. And so it was really, what got me really interested was the ability to use all the quantitative approaches like modeling and simulation and be able to see how that could be applied to actual like dose adjustment, for example, for certain patients at the clinic or at the hospital during my rotation. So that was kind of the main driver that prompted me to be very interested in clinical pharmacology. Yeah.
That's great. Brian, how about you?
Yeah, for me, I like chemistry and biology in high school, which kind of made me decide to choose pharmacy as my undergraduate and graduate trajectory. But by the first professional year of my pharmacy training, I realized that I much more like the research. So what I ended up doing was changing to a pharmacology bachelor's, specializing in med chem, and actually then worked as a chemist for 2 years at GlaxoSmithKline before I realized I really wanted to get more back into the clinical aspects of drug discovery and pharmacology, which sparked a 5-year transition between getting a master's, working as a PK research scientist at a healthcare technology company, and now getting my PhD in pharmacometrics and clinical pharmacology.
So what we have seen in recent years within ACCP is that there is an increasing interest by pharmacists and pharmacy students to gain a better understanding of clinical pharmacology in particular, and how this applies to potentially entering this field aside from working in clinical practice. So based on that, can you describe a little bit your actual area of research that you are conducting, that you are currently conducting or that led you to your graduation now. So let's start off with you, Brian, because you're still kind of in the midst of that, in the depth of your knowledge and the depth of getting to your goal.
Yeah, absolutely. So right now, most of my projects are focusing on PBPK, or physiologically based pharmacokinetic modeling, specifically for drug interaction, as well as special population applications for dosing optimization. I'm also working in a different side of pharmacy and pharmacology, which is the pharmacoepidemiology. So I'm doing a pharmacoepi study evaluating various aspects of macrolide antibiotics, particularly with resistance development with a nested case control approach for a large commercial population.
Okay, so that is
kind
obvious.
Go ahead. I was going to say kind of like the high-end outcomes as well as the mechanistic modeling aspects of ClinPharm as well.
Okay, so obviously that has a direct impact on how these drugs are being utilized in clinical practice, how it may benefit patient outcomes. When it comes to drug interactions, obviously, how can we avoid adverse effects when patients are being treated? How can we optimize drug therapy? So this is directly applicable to the work that others are then doing in the clinical practice setting. How about you, Kayla?
Yeah, so for my case, in terms of that, it actually directly kind of have that connection. My dissertation is a little different. It's more of a cumulative kind of dissertation where I work on different therapeutic areas and have actually the application of different pharmacometrics approaches to enhance decision making for special population. So for example, I work more on like the mechanistic, physiological based pharmacokinetic, like PBPK modeling, or the more semi-mechanistic system pharmacology model on post-menopausal osteoporosis patient. And then there's other projects that actually, from that project, basically it helps us to guide better biomarker selection. So we could kind of help with shorten the clinical trial. And that's a collaboration with the FDA. And then I have another project where I work also on more of the looking at the predictive performances between the current use or gold standard approach of allometric scaling versus the PBPK modeling for pediatric population. That's the other one where we're just analyzing what's the best way. And then there's also more of a collaboration with hospital as well. So we have a collaboration with a hospital in Philadelphia, Thompson Jefferson Hospital, where we actually take a look and apply, basically help them optimize clinical trial design for a special population, patients basically on peritoneal dialysis, and also patients that is on ECMO, which is basically a kind of like external gas exchange machine for critically ill patient. So it's just kind of a different project, but the outcome of all of them is to really see how it can enhance in either healthcare or basically for patients ultimately.
Now, both of your projects, both of you described it as one aspect of that was modeling, that you both do quite a bit of modeling, PK/PD or PD/PK, whichever you kind of, I think both are equivalent, in terms of combining pharmacokinetics with pharmacodynamics in some way or the other to provide an integrative or more holistic approach, whatever you want to call it, in regards to provide. I think, Kayla, you emphasized a little bit of the translational approach when you also mentioned allometric scaling, where we go from the preclinical stages to the clinical stages and then to clinical practice. And for you, Brian, you put a little bit more emphasis on already being in the clinical stages and then having nested approaches to optimize drug therapy to gauge kind of the risk that is included for different drugs. So when you think about where you are now and versus how you got there from your undergrad years, what kind of advice would you give to undergraduate students or early stage graduate students that may not have necessarily that vision yet of wow, seeing more advanced senior peers of where they at, what kind of advice would you give them? Because obviously now you have that knowledge, and years back you might have thought, gee, how can I get there, or how can I be there? Kayla, maybe you want to start.
Yeah, all right. So I would say for like undergraduate or early stage, really the first thing I would say is to volunteer and help out in, for example, like, I'm not trying to brag, but I think it's great to join something like ACCP student chapter if possible, or even any of the society like ACCP itself, just to have a flavor or have a feel of what currently, because you're so new to that field, you don't know exactly what everything is. And if you are really, and you want to know more what you're interested in specific area, even in the field of like clinical pharmacology, for example. So I guess the first way is to try to be involved, volunteer to help out in, say, for different committees. And other than that, really to even, let's say, assuming other than the society, talk to the senior students. Usually like the senior student, they have been through this, so they know a lot more of the struggle that they have gone through or the challenges that they have gone through. Talk to them and then see how they actually overcome it. So from there, you learn a lot from there, like from the peers, and also from the society, talking to professionals and a lot of mentors out there. Like in ACCP meetings, we meet a lot of mentors, or like we meet a lot of professionals there where they can help us a lot and give us a lot of sound advice.
Great. Brian, how about you?
Yeah, I mean, what Kayla just said is all great advice. So just to add a little bit, for undergraduates, one thing I would say is take biochemistry and statistics classes. That definitely would help in your graduate studies. Another major one that really kind of changed my life for the better in terms of getting into clinical pharmacology was identifying a professor on your campus who has research and a lab that you're interested in, and contact them and set up a meeting. Basically get to know what they're doing, get to speak with them, as well as ask to volunteer in their lab. And importantly, don't get discouraged if they tell you no at first. I mean, for my example, it took about a year of interacting and probably bothering a professor before he finally allowed me to volunteer in his lab. And I worked under a senior PhD student during my undergraduate time, and that was a major part of my transition into the clinical pharmacology research. It helped get me my first job, and really taught me I wanted to become a PhD rather than a pharmacist. So I would highly suggest that. For graduate students, especially early on, I would say start developing your network. As Kayla mentioned, going to scientific conferences, participating in on-campus volunteer and professional society volunteer work, committees and things of that nature are going to be immensely helpful. Participate in summer internships or fellowships is another big one, I'd say, for early graduate students, and even into your later graduate time before you're really focusing heavily on your dissertation and finishing. These summer internships, most industry offer them, as well as the FDA, and it's really going to help, one, increase your CV, increase your network with professional contacts, as well as teach you kind of what you may want to do in the future once you finish your PhD studies. So that would be my most advice. And I guess lastly, make sure you make some time for yourself during your graduate work, because it's going to be tough, and you're really going to want that life-work balance.
Yeah, thank you both. I think that is, when I look back on my graduate studies, certainly I sometimes feel like it might have aged me a little bit faster than I would have liked. But I think we all had our own experiences, and having that kind of network of peers just to kind of commiserate sometimes with, and also to have just some distraction is very important. But I think, Kayla, you brought up a great point that ACCP offers with the mentoring connection that we provide. I think that's something that we want people to utilize, especially younger members of ACCP. And somebody should not be shy about utilizing that resource, because that's exactly there for younger members, and we provide during the annual meetings a number of STEP-specific activities where we want STEP members to connect and to form a network that shouldn't only be there during the annual meetings, but year-round, really, to serve as a network to connect people across campuses. So if you're a graduate student or even an undergraduate or a professional PharmD student that does research, to really stay connected throughout the year, to exchange knowledge, to build on knowledge, and really compare, how does my experience compare to those of others? So I think that's very valuable, your experiences. Thank you for sharing that. So that leads me kind of to a very important point, and that was what you brought up, Brian. Make some time for yourself. What are you both doing when you are not working, when you're not spending 60 plus or 80 hours, going over data, being in the lab, or commiserating of how to phrase that one sentence in that manuscript that just doesn't sound right? What are you doing? So I think Kayla, you started. Now it's Brian's turn to start. What are you doing when you're not working?
All right. Well, so I like to cook, so I try to do that for my wife and I, as well as my wife and I actually play in like a weekly co-ed sports league. So that kind of gets us out of the house for an hour or two each week. Other than that, just hikes when we can. Then during the winter holidays, we always try to travel a little bit to just kind of refresh ourselves before another semester of as you said, time commitment.
Great. That's awesome. Kayla, what about you?
So officially, I have to say I only love to work, and in my free time, I only work. I'm just kidding. So that's just joke aside. To really like make myself have that balance, I think that's really like important, like what Brian was saying earlier. A lot of PhD students tends to start off and they get burnout, like really quickly into like the PhD like life, you get burnout. So what I have found that helps me a lot was I started like doing a lot of yoga and Pilates, and I also started like learning just new activities like salsa dancing. That's something that's in your area, like you can look at that. And then in my like during the times where there's like a long break or a long weekend, I like traveling, so I would travel I like hiking. I would go to different places for hikes, just to explore. And I kind of really like the extreme, like the winter hiking, because I think that's where everything is really calm and quiet, and that just really puts my adrenaline rush. So I really like that. And also I love baking. So my roommates are gaining weight because of current situation when we're stuck at home. So the baking part definitely helps. Chocolate always helps too.
Yeah, that is great advice. I think everybody seems to have a little bit of a cooking or baking. I think that's just because we kind of have that experimental, approach to things. So we like to just add a little bit of that and a little bit of that. And so, let's see how it turns out, right? Everything is, we always like to try to experiment with things. So, okay, the last question for both of you is, what are your plans for your future after graduation? How is this big kind of unknown after graduation for you? And Kayla, since you are definitely a lot closer to that big open new life, that next chapter in your life, how does it look for you?
So I'm actually looking more in terms of like looking at industry or regulatory like consulting position, more onto the professional positions. And in the meantime, after that, well, I'm also hoping to be helping out still with the different society, especially to the students, as I step forward into more of an early stage career professional. So that would be kind of like my short-term goals for now.
Great. Yeah. How about you, Brian? Still in the middle and the depth of research for your graduate? I know that's probably obviously your next big stake that you want to put in it, but how about afterwards? Right. Where do you envision yourself?
Yeah, so I plan on going academic with my career at this point. So I likely will start a postdoc training for a couple of years after graduation, and then apply for some type of tenure track position within a college of pharmacy.
Okay, yeah, that are both very very reasonable goals, I think. Obviously, also there's involved ambition and patience and dedication with all of this. And I think you are obviously very dedicated to the craft of clinical pharmacology. And we really appreciate you as leaders in both as students and now early stage professionals, as you advance in your own personal career and as valuable contributors to ACCP. So thank you so much for taking the time today for this interview, for being a little bit prodded, for your personal, professional kind of more, but also personal insights, for providing your insights to other students and to other early stage professionals, and opening up a little bit about yourselves to ACCP members. So that is it kind of for the podcast interview. Thank you everybody for listening. And thanks again, Kayla and Brian, for taking the time today.
Thank you so much.
Thank you.
Opportunity. Thank you.
Take care, everybody.
Okay.